want to protect the neurovascular contents of the adductor canal. Put your hand over the top of the quads and follow the femoral artery as it descends deep to the sartorius. Then have the patient abduct the leg. This will pop up the adductor longus tendon. After you grasp it, have the patient put their leg back in neutral or possibly in a slight external rotation. Now your thumb is over the adductor canal and neurovascular contents. You can safely advance the needle perpendicularly if you maintain a pincer grasp of the adductor longus muscle. Look for treatment zones with needle palpation skills. Once you've found the zone, rotate the needle slightly and maintain the pincer grasp to protect the neurovascular contents of the adductor canal. Treat the adductor magnus with the involved side down and palpate transverse to the direction of the fibers. Insert the needle perpendicularly. Then use needle palpation skills to discover treatment zones deep in the muscle and to let you know what depth and angle in which to leave the needle for the maximum effect inside the treatment zone. Rotate the needle slightly to enhance fascial winding of fibers around the needle. You will often find treatment zones in the most proximal part of the anterior tibialis, as well as the mid-belly. Palpate transverse to the direction of the fibers. When you've palpated what you think is a treatment zone, tap the needle in and advance it using needle palpation skills towards the tibia itself. Once you have discovered the best treatment zone, rotate it and leave it, and palpate the mid-belly portion of the muscle, again transverse to the direction of the fibers. When you found the treatment zone, tap the needle in and using needle palpation techniques, discover what the best treatment zone is. Once you have found it, just rotate the needle, advancing it toward the tibia. To treat the brachioradialis, take hold of the belly of the muscle in a pincer grasp. You will insert the needle to look for treatment zones from a superior to inferior angle, taking care to avoid the musculocutaneous nerve as it crosses the belly and continues distally along the lateral aspect of the muscle. Look for treatment zones in the belly between your thumb and index, then move superiorly to the tenoperiosteal junction using a flat palpation, taking care to avoid the radial nerve. To treat the biceps femoris, palpate transverse to its longitudinal fibers. When you find an area, insert the needle lateral to midline to avoid the sciatic nerve. When you advance the needle looking for treatment zones, advance the needle in a lateral direction, again to avoid the sciatic nerve. You can also rotate the needle to enhance the treatment. To treat the short head of the biceps, look for treatment zones in the mid-belly and insert this needle from the medial aspect. You will take a pincer palpation and literally lift the short head of the biceps up away from the humerus as you probe the muscle belly for treatment zones using needle palpation skills. By lifting the muscle up in this way, it helps to protect the underlying neurovasculature. To treat the short head of the biceps, look for treatment zones in the mid-belly and insert this needle from the medial aspect. You will take a pincer palpation and literally lift the short head of the biceps up away from the humerus as you probe the muscle belly for treatment zones using needle palpation skills. By lifting the muscle up in this way, it helps to protect the underlying neurovasculature. To treat the cervical multifidus, put your middle finger over the spinous process of the chosen segment and your index finger immediately adjacent to it. The entry point in the safe zone is the tip of your index finger, and your angle is always inferior and medial. Once you tap this in, put your palpating hand back in the exact same places to check anatomical landmarks. Advance this needle inferior and medial, and let go of it often to make sure you maintain this angle all the way into the multifidus muscle. To treat middle deltoid, palpate transverse to the direction of the fibers until you palpate a treatment zone. When you found it, tap the needle in perpendicularly and using a pincer palpation, advance the needle into the belly of the muscle, searching for treatment zones using needle palpation skills. Keep searching in this manner until you find an area with more resistance and tenderness. When you find it, rotate the needle to complete the treatment. Treat the gluteus medius muscle by palpating for treatment zones in the belly of the muscle. When you found a treatment zone with your palpating hand, take a 50 or a 75 millimeter needle, depending on the size of the patient, and insert it perpendicular to the curve of the buttocks. Using a flat and spreading palpation technique, advance this needle all the way to the periosteum, looking for treatment zones through the gluteus maximus and all the way into the gluteus medius. Look for treatment zones in the gluteus minimus by first identifying the gluteus medius and then moving laterally to look for treatment zones in the minimus. Take a 50 or a 75 millimeter needle, depending on the size of the patient, and insert it perpendicular to the curve of the buttocks. Advance this needle through the gluteus maximus into the gluteus medius and keep on advancing it all the way to the periosteum using needle palpation techniques.